Joining me now is the Democratic Representative Kelly Morrison of Minnesota. She's a member of the House Veterans Affairs and Small Business Committees. She is an obstetrician and a gynecologist. Representative, good to see you again. Thank you for being with us.
Thanks so much for having me, Ali. Good morning.
I was talking to Chris Hayes an hour ago, and he said, for all the hand-wringing about what Democrats should be talking about and how they should be focusing on things, this one's not a mystery. Democrats seem to be united around the fact that we're going to have to message to people that they're cutting your Medicaid. That's bottom line. People's Medicaid is getting cut to pay for wealthy people's tax cuts. It's not much more complicated than that.
That's exactly right. And I've been trying to do my part to raise the alarm bells about this, Ali, because this will be devastating to our entire country. We're talking about health care for more than 80 million Americans, and that's across the lifespan. We're talking about kids, we're talking about pregnant women, we're talking about older people, we're talking about people living with disabilities. And I think sometimes people don't know that they get their health insurance through Medicaid. Here in Minnesota, we call it medical assistance. In Wisconsin, next door to us, they call it Badger Care. So this is essential health care throughout the lifespan. And even if you don't get your health insurance through Medicaid, you will be impacted by this because these cuts will mean hospitals are going to close, clinics are going to close, long-term care facilities are going to close. And so the places that you get your health care will also be impacted. This is going to impact all of us. Ali, I've been trying to make the case that this is a national security issue.
You say something interesting here where you say not everybody knows they get their the health care through Medicaid. And that's actually not a bad thing, right? When government works properly, you don't actually need to know. You just need to know you're just getting your health care. But in Minnesota, where you're talking about medical assistance, 1.3 million Minnesotans are on this, 42% of whom are children. So just help us understand. You started there with the idea that rural health centers might close, community health centers might close. But for the people who actually receive these 1.6 million Minnesotans, what do these cutbacks mean to them?
Well, we're talking about 650,000 children here in Minnesota. And, in rural Minnesota, more people are using Medicaid to get their health insurance than in our urban areas. So this is going to impact kids, and this is going to impact older people, and this is going to impact people living with disabilities. This will be devastating. Our rural hospitals, as you well know, are already in deep trouble. This will be the final nail in the coffin for them if these cuts go through.
Let's talk a little bit about.
Add too, Ali.
Yeah, go ahead.
Sorry, go ahead.
No, please.
I was just going to say, even some of our Republicans here in the state legislature in Minnesota just sent a letter to our Republican members of Congress and to President Trump, begging them to not go through with these cuts because they know that these cuts will hurt their constituents. So I think Republicans are starting to recognize the danger of these cuts. And if there's any message that I can get across to my Republican colleagues is that health care is not just a budget line item that you can cross out. This is about people's lives.
Yes.
This is about the future of our country. It's about the security of our nation.
And every other modern Western democracy understands that. In fact, we're the only one that still struggles with giving people their health care. Chris made a really good point an hour ago. He said, what the Republican Party has emerged into is not the party of the rich that it used to be. So this kind of thing, which may have made sense 25 years ago, where rich people get tax cuts, Republicans can support that, and poor people don't. As you mentioned, a lot of this is money that goes to rural areas. The Republican demographic has expanded and changed into people who are, in some cases, Medicaid recipients. This is going to hurt them as much. It doesn't matter what your party, what color your party is. This is going to hurt people across the board.
That's right. That's right. And it begs the question again. Why are we doing this? Why are we even talking about doing this? And the reason is so that we can cut taxes for the very wealthiest among us and to give tax breaks to our largest corporations. We don't have to be doing this. We can talk about creating a responsible budget. That's something that needs to be done over the long term. You can't just slash things right now. And why? Again, I come back again and again. The only reason we're doing this is to create tax cuts for the wealthiest among us. Honestly, Ali, it doesn't make sense. It's cruel, it's chaotic, and it's not doing anything to lower costs for Americans. President Trump said day one he was going to lower costs for Americans. Cutting these benefits will only have the effect of making life more expensive for the American people.
Yes, it's a good point. You can find an alternative to expensive eggs. You can't find an alternative to your health care coverage going away. By the way, while I've got a doctor here, I do need to ask you about measles, and vaccinations and some weird stuff coming out of the HHS? Because you've got a better voice than most people on this because you're a physician. Talk to me about this.
Oh, it's so upsetting. You know, we finally have a critical mass of Democratic doctors in the House, and we formed the first ever Democratic Doctors Caucus this year. One of the very first things we did was hold a press conference to talk about our concerns about RFK leading HHS. You know, we're seeing this deadly measles outbreak in Texas in a community that has a high percentage of unvaccinated kids. And one child died. Measles is one of the most contagious and one of the most preventable diseases in the world. And we've got someone running our Health and Human Services Department now who's been a vaccine denier, who has profited off of spreading mis and disinformation, and we're seeing the consequences there. So I would just encourage people to remember that vaccines are one of the greatest public health accomplishments of modern human history. Get your kids vaccinated. It prevents disease and death.
I think I saw that 9 out of 10 unvaccinated people who are exposed to measles will get it. And it's not like COVID or the flu where you have variants. You're going to get measles. It's going to be bad. Measles is a very, very dangerous thing for a child to get. Kelly Morrison, great to see you again. Thank you for being with us. The Democratic Congresswoman Kelly Morrison of Minnesota.